Good day, everyone. We are about to start the program in a few minutes. May we request everyone to please take your seats and direct your attention to the screen for some important reminders. Thank you.
When you hear this sound, it means that we are having an emergency.
Let us put ourselves in the presence of God. Our Heavenly Father, we praise and thank you for today. Thank you for gathering us in this important event for science, technology, and innovation. May your grace be upon us. We pray for guidance in the matters at hand. May you enlighten our minds so that we may receive your wisdom. Open our spirits so that we may know your leading. Help us to work together and encourage each other to excellence so that we may be channels of blessings as we bring science and technology to the people. Make us your instruments of positive change and genuine service. All that we do here today, all that we accomplish, is for the service of humanity and for your glory. May you cause the works of our hands to prosper. We ask this in your name. Amen.
You may now take your seats. Thank you. Good morning, everyone!
I am Jel Miranda from DOST Science and Technology Information Institute.
And I am Michael Angelosia from the DOST Philippine Nuclear Research Institute. And we are your hosts for the 7th National Research and Development Conference, or NRDC.
With the theme, Sustaining the R&D Momentum for Prosperity and Wealth Creation. And we are live on site here at the Philippine International Convention Center.
Yes, partner, and we are also live streaming via Zoom, Facebook, and YouTube. So for your friends, family, and colleagues who would like to join us today, please share any of these links so they can join our 7th NRDC.
Yes.
A few reminders for our live audience. Please make sure that we all adhere to the health protocols and keep your face masks on to stay safe. Right, partner?
Yes, Mike. At syempre, excited na ako na makasama yung ating mga participants sa araw na ito. Diba? Syempre, 2 years din virtual yung ating NRDC, diba? And I'm excited with Mike as my co-host for today's event.
Yes, partner. I'm really excited as well. Pero napakarami nangyari. A lot has happened and a lot has changed in the past 3 years. Napakarami nating nakita, natutunan at na-realize, right?
Tama ka dyan, Mike. And in fact, one thing that the pandemic has emphasized is the importance of research and development and the role of science and technology and innovation play for us to cope, to recover, and rise above the challenges brought about by COVID-19.
Yes, partner. But more than just coping, na-highlight din ang role ng R&D or research and development in social and economic progress. We realize that indeed, innovation propels us forward towards growth. Hence, this year's NRDC highlights the role of R&D for prosperity and wealth creation.
And one other thing that the NRDC emphasizes every year is the importance of doing R&D together. That is why we make it a point for various institutions and agencies to gather annually as a sign of our commitment to pursue the harmonized national research and development agenda.
Yes, and speaking of commitment, diba? We developed or we still celebrate the NRDC in the past years, kahit na online yung ating platforms, di ba? And it's good to know that we are here face-to-face with hybrid setup with today's or this year's NRDC. Partner, at this point, hindi naman mangyayari ang NRDC na ito because kung wala yung ating mga kasama here sa likod ng NRDC.
Yes.
Because at this point, let us acknowledge those behind this conference because this year's NRDC is led by none other than the Department of Science and Technology, DOST. So kaway-kaway po sa mga kasamahan natin.
Asan ang mga kasama
from
natin sa DOST? Taas ang kamay! Ayan, good morning everyone. At syempre, bukod sa mga kasama natin dito sa PICC, binabati din natin yung ating mga participants via Zoom and Facebook. I think libo yung ating kasama sa araw na ito.
Yes,
Ayan.
talagang sinubaybayan nila ang pagbabalik ng NRDC this year. And of course, aside from the employees, staffs, and executive directors and organizers ng DOST, with us in this year's NRDC ay ang mga sumusunod. Kaway-kaway naman po from our guests from Commission on Higher Education.
Hello, sir and ma'am. Good morning from the Department of Agriculture.
From the Department of Environment and Natural Resources.
Department of Information and Communications Technology.
From the Department of National Defense.
And from the Department of Energy.
Of course, from the Department of Health.
Department of Transportation.
Department of Public Works and Highway.
And Department of Trade and Industry.
Of course, kasama natin the Philippine Space Agency.
Alright, maraming salamat po sa mga kasama natin. Ngayon pa lang talaga, sobra na ipasasalamat natin kasi kung hindi dahil sa kanya, hindi magiging successful itong ginagawa nating programa.
Yes, partner. And aside from them, of course, we would like to acknowledge our lawmakers, our partners and friends in the academe and in the private sector. A round of applause for everyone.
And to formally welcome us to this event and to present the state of R&D in the Philippines, ladies and gentlemen, please welcome the DOST Assistant Secretary for International Cooperation and Officer in charge of the Office of the Undersecretary for Research and Development, Dr. Leia J. Buendia.
His Excellency President Ferdinand Marcos Jr., Secretary Renato Solidum, Commissioner De Vera, Secretary Yulo Loizaga, Secretary Uy, Secretary General Faustino, Secretary Lotilia, Secretary Manoan, Secretary Pascual, Secretary Bautista, Undersecretary Vergere, Director General Marciano, officials and members of our partners in government, our private industry partners, members of the research community, our colleagues at the Department of Science and Technology, friends from the media, ladies and gentlemen, a pleasant good morning to all and welcome to the 7th National Research and Development Conference. There are two reasons why we are holding the NRDC annually. First is to promote technology transfer as provided under Section 19 of Republic Act 155 or the Technology Transfer Law. Second is to facilitate the dissemination of all output programs and projects under the Harmonized National R&D Agenda or HNRDA. In today's conference, we will witness impactful R&D efforts despite the challenges and leading issues faced by the R&D community. The COVID-19 pandemic has disrupted our way of life in many ways. Researchers were overwhelmed to come up with innovative solutions with limited physical access to laboratories and with slowed down logistics across the country. The Philippines has long experienced regional disparity in access to financial resources that could potentially fuel socioeconomic growth and innovation. In 2016, most of the R&D activities in the country were concentrated in NCR, the Calabar Zone, and Central Luzon. Moreover, out of 2,000 higher education institutions, only 85 had partnerships with publicly funded R&D. Public investment in R&D remains low, averaging at 0.6% of the annual national budget. The UNESCO suggested R&D expenditure is R&D investment from the private sector remains low as well, at an average of 0.12% of the GDP only, significantly lower than the OECD average of about 1.4% of the GDP. While we have more graduates of master's and doctorate in science and engineering, they are not readily absorbed by industries to undertake R&D. Low collaboration between the R&D efforts of academic, industry, government leads to a disconnected value chain between knowledge, value, and impact creation. The share of the private sector to public R&D is likewise low, compared to the OECD average of about 61% of the annual public R&D expenditure. With these ongoing challenges and the limited resources we have, how do we sustain the R&D we are doing to create wealth and achieve prosperity? First, the country will continue preparing for the next pandemic and other disease outbreaks that may occur. Fortunately, the 19th Congress shares this urgency, and the proposed bill on the establishment of the Virology and Vaccine Institute of the Philippines remains a priority of the current administration. The reactivated pharmaceuticals section of the Department of Science, Technology, Industrial Technology Development Institute will accelerate the R&D translation from drug discovery to market deployment of the Tuklas Luna centers. As we encourage R&D and innovation, we will also continue addressing regional disparity in access to R&D funding by implementing programs and projects such as the NICER or the niche centers in the regions for R&D under the Science for Change program. Currently, there are 44 existing NICERs across all the 17 regions of the country with a total approved funding of 2.36 billion. 70% of the funding for NICER had been provided to the regions outside of the NCR, Calabar Zone, and the Central Luzon. Moreover, in partnership with the Department of Trade and Industry, we have established regional inclusive innovation centers across the country to leverage on the commercialization of market-oriented R&D that would lead to increased regional competitiveness. Another goal of our present government is to increase the employability of our people. Towards this end, the Department of Science Technology will continue implementing programs that would help build the capacities of the Filipinos. There is the R&D Leadership Program, which engages local experts to assist in strengthening the capabilities of state universities and colleges and bring out the latent talent of their researchers. Another DOS initiative that we intend to intensify is the Balik Scientist Program. Just recently, the BSP has provided support to the establishment of the Virology and Vaccine Institute of the Philippines. We will likewise continue engaging the private sector to do and invest in R&D. We now have the Collaborative R&D to Leverage Philippine Economy or CRADLE program, which enables innovation through academic industry collaboration. Currently, we have 86 CRADLE projects across the 10 regions of the country for a total approved funding of 393.6 million pesos, which in turn induced investment from the private sector, both in cash and in kind, worth 143.6 million pesos. Banking on the success of the CRADLE projects, we have expanded the benefits of academic industry collaborative R&D projects to address and find possible solutions to industry-wide problems through the iCradle program. The first project under the iCradle is the collaboration between the Philippine Carabao Center and the Federation of Cattle Raisers Association of the Philippines and several cattle dairy farms. Support to the industry sector is also provided through the Business Innovation through S&T for Industry, or the BIS program, which facilitates the acquisition of relevant technologies by Filipino companies for immediate incorporation in their R&D activities. Currently, there are 4 company grantees under the program with a total approved financial assistance of 43.4 million pesos. One other program that could promote investments and create jobs is the Technology Business Incubation or TBI program. To date, there are 48 TBIs established through the assistance of the DOST sectoral councils. These TBIs, in turn, were able to nurture more than 200 startups and produce more than 70 full-blown startup companies, resulting in the creation of over 800 jobs. The startups, on the other hand, have already generated more than 100 million pesos in investments from both the public and private sectors and generated over 60 million pesos in terms of revenue. The goal of the Department of Science and Technology to provide the country with the means and resources that will bring socioeconomic development is echoed by our colleagues in the government service. The Department of Agriculture, for one, is helping our farmers generate income even during off-planting seasons. We will learn all about these things later in the program. We will also get to hear our friends from the DNR, DNB, DOTR, and DPWH talk about their own programs and projects in the area of industry, energy, and emerging technologies. A few years ago, the DOST started tinkering with the idea of building the country's space technology program. We are very pleased that in this NRDC, we are joined by our colleagues from the Philippine Space Agency who will give us an eye view of our efforts in this area. The efforts of the ICT and DTI in terms of education, expanding and improving the country's digital infrastructure, and developing our micro, small, and medium industries will likewise be presented. In the past 2 years, the main preoccupation of many Filipinos in terms of health is battling COVID-19. But there are many aspects of health that needs attention, including cancer, drug discovery and development, addressing people's disabilities, and improving our health services, among others. We are pleased to inform you that our research community are looking at all these things, and I am sure we will be all interested to hear what has been done in this regard. And of course, another main interest for us is to hear about the efforts and initiatives on disaster risk reduction and climate change, particularly on improving our forecasting and warning systems and building resilience. In recognition of the R&D community's efforts, the DOS is very pleased that though we have not been spared from the effects of the pandemic, the Philippines has almost sustained its best ranking in the Global Innovation Index 2021, landing at the 51st spot, single slide from its 50th spot in 2020 out of 131 economies in the world. Moreover, the Philippines has proven its efficient innovation performance through consistently producing innovation outputs even with low inputs since 2014. We have continuously increased the pool of researchers, the scale of research in almost all regions, and industry-academia research collaborations significantly increased equitable funding in the regions. To sustain this trend of positive changes, the DOST will continue implementing a whole-of-nation approach to optimize the impact of government funding towards inclusive innovation and ensure its multiplier effect to intended beneficiaries. To this end, we call on everyone's steadfast commitment to further science, technology, and innovation in the country and continue the stellar momentum of our innovation performance. We are pleased that the Science for Change Program Bill is one of the priority bills identified by the current Congress. Through this legislation, we will be able to ensure the funding for R&D and its equitable distribution all over the country. We have long been saying that R&D makes positive change happen. Let us all make that positive change and lead the way towards the country and our own prosperity. Thank you and good day, everyone.
Thank you so much, Asik Buendia, for giving us a glimpse of what the DOST and the government in general are doing to help make our lives better.
Yes, and now for the keynote message, let's hear from a man who has dedicated his life to disaster risk reduction in the public service. Such dedication led his distinction as a Presidential Lingkod Bayan awardee. Ladies and gentlemen, it is our honor to introduce the new Secretary of Department of Science and Technology, Dr. Renato U. Solidum Jr.
Esteemed colleagues from the government, especially from the Department of Agriculture, Department of Environment and Natural Resources, Department of National Defense, Department of Energy, Department of Health, Department of Transportation, Department of Public Works and Highways, Department of Trade and Industry, the Commission on Higher Education, and the Philippine Space Agency. Our research partners from the academe and the private sector, representatives from the local government units, members of the DOST family, friends from the media, esteemed guests, ladies and gentlemen, isang maganda at mapagpalang araw sa ating lahat. We are very pleased that you could join us today for the 7th National Research and Development Conference. We at the Department of Science and Technology are gathered here today as one voice, with one goal and one institution. That's why our new battle cry is One DOST for You. This is the first face-to-face installment of the NRDC since 2019, and we are happy to see all of you once again to celebrate the triumphs of research and development. Allow me to start by giving you an overview of the research and developments in the country. At DOST, I have summarized our activities into 4 functions. 1. Wealth creation through economic development and job creation. 2. Wealth protection through climate and disaster resilience. 3. Human well-being through health, education, access to water and energy. And 4. Sustainability by making sure that the natural resources are protected and conserved for future generations. We do this in partnership or in complementation with the other government agencies such as the DA, DNR, DND, DOE, DOTR, DPWH, DTI, CHED, PhilSA, and the country's research community. Back in 2017, the DOST, in collaboration with other national government agencies and partners from the academe, industry, and private R&D institutions, prepared the Harmonized National R&D Agenda, or HNRDA, for 2017 to 2022, to align the country's R&D priorities with the present needs of the country. This is to ensure that the results of science, technology, and innovation will positively impact our ultimate goal for socio-economic development. The National Research and Development Conference is an event that promotes coordination and collaboration among stakeholders of research and development and innovation. It highlights ongoing and completed R&D projects and programs that are aligned to the priority areas of the Harmonized National Research and Development Agenda that will be for the use, benefit of society, and to economic development. Last year, the theme of the 6th NRDC is the road to recovery through R&D. It was a framework of the key aspects that needed to be considered in neutralizing the effects of the pandemic. This year, we will bring the solutions from R&D to our most productive sectors. The 7th NRDC theme, Sustaining the R&D Momentum Through Prosperity and Wealth Creation, underscores innovation's role in furthering our country's economic goals in generating wealth, achieving prosperity, and ensuring the security of the Filipino people and the whole country. Science, technology, and innovation, or STI, play important roles to the development of national wealth. Wealth is associated with proper management of assets and liabilities of both the public and private sector. There is a need to focus on the importance of assets generating a return to cover their investment cost. Since the pandemic broke out, innovation has been equated with progress. We need to invest in innovation today to ensure our country's post-crisis growth. For an economy to achieve a level of prosperity, it needs to produce outputs that are greater than its inputs and we must have the speed and capacity to shift to the changing demands of the market. In 2020 and 2021, the DOST revealed its quick response to the ongoing pandemic by unveiling 20 innovations in 2020, subsequently followed by 21 innovations in 2021 that would provide innovative solutions to address some of the country's problems in different sectors. At the forefront are health innovations that provided solutions to the ongoing pandemic. Included in the list are innovations that support local companies, most especially the micro, small and medium enterprises, or MSMEs. According to the Philippine Statistics Authority, in 2021, more than 1.08 million establishments were in operation. About 977,670, comprising 90.5%, compose the number for MSMEs. The iron and steel industry comprise the bulk of materials needed for economic development. Given the vastness of our natural resources, especially in mineral reserves and iron ore, support must be given to our local companies. With the income potential of the steel industry, the DOST invested in testing facilities with the objective of helping small companies to be more competitive, to be more productive, and be able to export. The Analysis and Testing Division, or ATD, is one of the frontline departments of the Metals Industry Research and Development Center, or DOST MIRDC. It offers scientific and technical services through its various facilities: chemical and corrosion laboratories under the Analytical Laboratories section, auto parts testing laboratory, mechanical laboratory, and non-destructive testing laboratory under the Physical Laboratory section, and the Metrology and Instrumentation laboratories under the Instrumentation and Metrology Laboratories section. The Analysis and Testing Division, or ATD, has been serving the metals, engineering, and allied industries through these facilities. There are also the 3D printers available at the Advanced Manufacturing Center, or AMCen. Through this technology, a company can save as much as 50% depending on the quantity and other requirements on new or verified products compared to other conventional manufacturing processes like machining and molding. But the investments are not enough. For example, the steel industry and construction companies are complaining that steel testing turnaround time is too long. Expanding testing capacities at DOST, MIRDC, and other laboratories are needed. As early as 2012, the DOST introduced one lab to provide a unified network of laboratories that conducts various tests in areas such as chemical, microbiology, food, cosmetics, metals, adhesives, pesticides, furnitures, cement, construction, dried raw seaweeds, halal, alkaloids, plastic, tiles, fertilizer, paints, plants, rubber, wood, water, marine products, shelf life, electrical, dairy, wastewater, calibration, textile and fabrics, and more. One lab services are offered by both local and international laboratories from Vietnam, Malaysia, Thailand, United Arab Emirates, and Australia. As the network expands, more services shall be added. To support the steel industry, manufacturing, and other large industries, the DOST created facilities to support the DOST Advanced Device and Materials Testing Laboratory, or ADMATEL. The ADMATEL is a national testing facility that houses sophisticated and advanced analytical instruments for failure analysis, or FA, and materials characterization. Through DOST ADMATEL's testing services, multinational companies were helped to develop and design new products, address product recalls, and optimize its production processes through failure analysis, or FA. In 2018 alone, DOST ADMATEL was able to support 30 unique companies with testing needs, which is equivalent to an estimated 2.4 trillion pesos worth of potentially compromised products. As a leader in pandemic efforts, the DOST-assisted spin-off company, Manila Health Tech Incorporated, remains steadfast in their goal to make molecular biotechnology affordable to Filipinos. The company pushes to provide cheaper but highly accurate detection kit for the Filipino people and the world. With the implementation of the Tuklas Lunas program, funding for drug discovery and development were significantly increased. Further, more regions and institutions are funded. To date, the Tuklas Lunas program has supported and partnered with 28 institutions nationwide. These institutions work closely together to help in the implementation of projects addressing various stages of drug discovery and development. With safety in mind, the design of the Virology Institute of the Philippines, or VIP, is based on existing World Health Organization guidelines on establishing virology laboratories in compliance with biosafety and biosecurity protocols. It is equipped with an animal house and a greenhouse for animal and plant virus research. Aside from biosafety level 2 laboratories, it will have biosafety level 3 laboratories and the maximum containment level, biosafety laboratory 4, a first in the Philippines. Having shown the facilities that we have built, we also need to replenish them with competent human resources produced by DOST-supported programs like the Balik Scientist Program and S&T Fellows. These investments yielded great results and reflected the country's S&T progress as highlighted in the Global Innovation Index, or GII, over the past 3 years. The Philippines was ranked 73rd in 2018, then surged to 54th in 2019, and finally breaking into the world's top 50 innovation achievers in 2020. The pandemic may have taken a toll on us in 2021, bringing us down a notch to rank 51st, but the country is still recognized as an innovation achiever for delivering more innovation outputs than what is expected. We could say with confidence that our country has achieved a very strong positive momentum in terms of research and development. For this 7th NRDC, I am very pleased to see that we will be highlighting programs, projects, and researches that contributed to wealth creation in 5 broad areas: health, disaster risk resilience and climate change adaptation, information, communications, education and industry, agriculture, aquatic and natural resources, and industry, energy, and emerging technology. I hope you could join us through the full duration of the program to hear about these exciting endeavors. Many of us believe that health is wealth, and the COVID-19 pandemic has taught us this lesson the hard way. The health of our citizens is at the forefront of our nation's capacity for generating wealth. In one way, the pandemic has been a significant driver of innovation as it led to the development of several innovations, particularly in the areas of diagnostics, biomedical devices, digital and frontier health technologies, and drug discovery and development, among others. Just like in health, the country's ability to cope with disasters and the adverse effects of climate change plays a significant role in ensuring wealth creation through wealth protection. The 2021 World Risk Report places the Philippines at 8th among 181 countries worldwide in terms of disaster risk. The damage caused by extreme weather events, earthquakes, volcanic eruption, and other natural hazards cost our country billions annually. The recent magnitude 7.0 earthquake, which struck northern Luzon in July this year, caused infrastructure damage amounting to 1.8 billion, and the reach spans from the Ilocos region to as far as Metro Manila. Typhoon Odette, which devastated Visayas, Mindanao, and some parts of Luzon, caused agricultural infrastructure damage amounting to more than 28 billion pesos. Investing in disaster risk resilience is crucial as the country contends with these natural phenomena. The more we are ready to face these events, the more we conserve our investments in agriculture and infrastructure. As we traverse the roads of the fourth industrial revolution, we are gearing towards a fast-paced, technology-driven change. A number of experts say that information is the oil of the 21st century. Indeed, information has touched almost all aspects of our life in this digital age, from the ways we communicate, the ways we educate our children, the way we look for jobs, to the ways companies and enterprises conduct their businesses, among many others. With the proper use of information and communications technology in education, trading, entrepreneurship, and many more, we could definitely assert the country's place in this era of digitization. Likewise, we are seeing the increasing demand for innovations in the energy and transport sector. And that is why we should also give emphasis on strengthening R&D in the areas of sustainable transport, the development of cleaner energy, and the advanced sciences such as space technology, quantum computing, and artificial intelligence. Despite the country's ventures into industrial revolution and our embracing the digital age, the Philippines remains an agricultural economy. And more than just health, the pandemic has also exposed the vulnerabilities of our livelihoods with the disruption of the global supply chain and the challenges encountered in the delivery of services. In particular, our agricultural sector, which is tied to food security, has been hit heavily. As such, it is imperative that we restructure and step up the means by which we conduct agriculture and conserve our natural resources and steer the direction of agriculture towards food resilience and resource conservation. To show our full commitment in achieving prosperity and wealth creation through research and development, we shall build up on what the 2017-2022 HNRDA has achieved. To this end, we have prepared the Harmonized National Research and Development Agenda for 2022 to 2028. The agenda is tailored to fit the 8-point economic priorities of the Marcos administration, with particular focus on the areas of food security, health, nutrition and lifestyle improvement, sustainable transport, development of clean energy resources, digital infrastructure, and creation of quality jobs. I enjoin all of you to work hand in hand with us in the Department of Science and Technology in the implementation of this agenda, so we may bring the fruits of our research and development efforts to all corners of the nation. Together, we shall unify our science, technology, and innovation narrative. This way, we shall deliver socio-economic impact. We shall not limit ourselves to agencies and the academe. Development, participation,
Thank you so much, Secretary Renato Yusilidum Jr. And alam mo, mga kaibigan, Mike, ilan lamang po yan sa mga accomplishments and ongoing and upcoming projects po ng Department of Science and Technology sa pangunguna po ng ating bagong kalihim, Secretary Renato Solidum Jr.
Yes, at sino nga bang hindi nakakakilala sa ating bagong DOST Secretary, ang nag-iisa, the one and only, no?
Yes.
Mr. Fault Finder.
Correct, correct. Alam mo, ay, bata pa ako talagang, iniidolo ko na yan, si Secretary Solidum. And before natin ay pagpatuloy ating programa, at this point, we would like to acknowledge the presence first of our former Secretary, Secretary Boy de la Peña. Hi,
Good
sir!
morning, Sec Boy, former Sec Correct, boy.
Yes, alright. At syempre, medyo nabitin kasi ako, Mike. I think
Tama.
nabitin din yung ating mga kasama dito sa PICC doon sa mga magagandang balita na i-share sa atin ni Secretary
Exactly.
Rene.
Kaya naman, partner, ano pa ba? Andito na tayo sa NRDC, dito sa PICC, and kasama natin ang nag-iisang Mr. Fault Finder. So may we invite here on stage the new DOST Secretary, Secretary
Renato U. Solidum Jr.
Magandang umaga po sa inyong lahat. Let me read first one of the verses that I wanted to share with you. 1 Chronicles 16, verse 8. Give thanks unto the Lord, call upon His name, make known His deeds among the people. Given the current geopolitical tension, supply chain problems, food insecurity, climate change, and many others, people would want to really know not only the good news that we proclaim, but more importantly, the good deeds that we can deliver to them. As scientists, as researchers, as public servants, we need to make sure that we don't only talk, but we walk the talk. And I'm very glad that during this Research and Development Conference, we will be showcasing science, technology, and innovation that have been produced in the past years so that our people can really relate that science, technology, and innovation is for them. This is the time where the scientific community, through the leadership and coordination of the Department of Science and Technology, can really prove that we can address not only the global problems, but more importantly, national and local issues that everyone would experience from time to time. I hope that you will be one with us in making sure that the agenda of the scientific community aligned to the current administration's socioeconomic agenda will really be meaningful and impactful. Let me just reiterate, if one would ask to describe what we do in DOST and as a scientific community, I can summarize this into 4. Many of our efforts are geared towards wealth creation as mandated by law when DOST was created. But being part of an archipelagic country prone to many natural hazards and also really at risk to global warming, we need to protect the wealth that we create through disaster risk reduction and climate change adaptation for resilience. Promotion of human well-being is another part of our mandate through health and access to education, water, good environment, and many others. And lastly, we need to ensure that all our efforts are sustainable, where we protect our environment, our rich natural resources for the sake of the future generation. All of this can be done, but through the collaborative efforts of everyone. As mentioned in the video, we in DOST do science for the people, but we should work together as one DOST and one scientific community for everyone. That is why we in DOST would want to be known as one DOST for you. You meaning an individual, a family, a community, local government, up to the national leaders. I think if we really believe that science, technology, and innovation would work out for the best of our people, then join us in making sure that our research and development are really impactful and meaningful. Marami pong salamat sa inyong pagdalo dito sa conference and even those online, because your presence is a testament that you support one scientific community for the people and for the country. Marami pong salamat sa inyong lahat.
Alright, thank you, Secretary Salidum. Grabe, we are very, very excited to hear various R&D endeavors that would foster various creations and enhance and with the well-being of every Filipino. As said by our Secretary, this is one DOST for
For
you.
you. Ayun.
Yes, and today we will hear about the programs and projects related in health, disaster risk reduction, and climate change adaptation, and as well as in information, communications, education, and industry.
And tomorrow, we will learn more about the efforts in the fields of industry, energy and emerging technology, and of course, those for agriculture, aquaculture, and natural resources.
Yes, partner. And I know we are all eager to see and learn what are these programs for wealth creation. So to start the ball rolling, let us hear from the health sector, beginning with a message from the officer in charge of the Department of Health, the DOST Undersecretary, Maria Rosario S. Vergere.
Department of Science and Technology, our distinguished guests, panelists, colleagues from government, fellow healthcare workers, partners for the universal healthcare, ladies and gentlemen, a pleasant day to all of you. Thank you for giving the Department of Health an opportunity to participate in the 7th National Research and Development Conference and share with everybody our continuous and expanding work on universal health care. For years, we have built a strong partnership with the DOST PCHRD to strengthen the health sector's research capacity. This includes the implementation of the DOH Health Systems and Research Management or HSRM program, which later became known as the Advancing Health Through Evidence Decisions with Health Policy and Systems Research, or the AHEAD HSPR program. Through these programs, the DOH has commissioned more than 300 research projects to date, in partnership with the Philippine Institute for Development Studies, University of the Philippines National Institutes for Health, Department of Science and Technology, Philippine Council for Health Research and Development, and other research institutions. These research projects are mostly health policy and systems research oriented to address evidence gaps in the UHC law, while some are operational to address program-specific needs and respond to the challenges of COVID-19. The DOH has also implemented innovative strategies and initiatives to further increase universal health coverage. For instance, we have issued public policies and legislative actions on different health priorities that influence behaviors and create supportive environments for Filipinos. These include the implementation of the settings-based approach, recognizing that the environment where we work, where we live and play are conducive for healthy behaviors. As such, the DOH and other key government agencies are working towards institutionalizing this approach to ensure better and stronger implementation for healthy settings such as the communities, the schools, and workplaces in the Philippines. Similarly, the DOH is also initiating the conduct of participatory action research as an approach that emphasizes the active involvement of partner communities in the planning, design, and implementation of interventions that directly address health and health-related needs of communities. In 2022, we also developed the Omnibus Health Guidelines per life stage with professional societies and the academe to serve as the main policy reference for setting standards of care and to ensure the safety and quality of healthcare services. The Omnibus Health Guidelines is based on quality-appraised clinical practice guidelines and the best available evidence and is meant to provide an integrated and consolidated approach to health service delivery through the different life stages and across the continuum of care. These include health promotion, prevention, screening, diagnosis, treatment, rehabilitation to palliation in various levels of care and various settings. Lastly, the DOH has also led the institutionalization of the health technology assessment process, which serves as a mechanism recommendatory to the DOH and PhilHealth for the guidance for financial investments, regulation, and determination of a range of benefit packages. Such process undertakes technology appraisals with an aim to improve overall health outcomes and ensure equity and sustainability of coverage for all Filipinos. As we expand the scope and breadth of these research and evidence initiatives to address health system gaps in the entire country, we will need all of you, our partners, to scale up in our research and development efforts. This is why platforms like this conference are critical, as they work to rally all of our partner scientists and researchers, even outside of the healthcare sector, to guarantee that all of our policies, programs, and initiatives are supported by sound evidence and aim towards improving people's welfare. The DOH recognizes your enduring commitment to research, and we look forward to continuing our relationships to build national and regional capacities for evidence generation and research management. Maraming salamat po at mabuhay tayong lahat.
Thank you, DOH Undersecretary Vergere, for the initiatives and strong support of DOH in science, technology, and innovation.
Thank you so much, ma'am.
Okay, let us now listen. Before we proceed,
Yes,
partner,
yes.
right? We would like to acknowledge a lot. Grabe, napakarami po
Correct,
natin kasama here and also online in the 7th NRDC. We would like to acknowledge some of our participants joining us from the Office of the Civil Defense, Rayners Research and Development Institute, Inquiry, Sultan Kudarat State University, Central Philippines State University, and many, many more. Grabe,
At
napakarami.
kung babasahin natin yan, siguro kulang yung oras natin. Pero nagpapasalamat tayo ng marami sa marami nating partner sa event na ito.
Yes.
And now, let us listen to the various presentations highlighting the importance of health in R&D. Alright,
Yes.
our first presenter is a molecular microbiologist, a medical doctor specializing in infectious diseases, an entrepreneur, and a community servant.
Yes, he is currently the Deputy Director of the Strategic Initiatives and Emerging Programs at the UP Manila National Institutes of Health and the Deputy Executive Director of the Philippine Genome Center. He is also the founder and CEO of Manila Health Tech Incorporated, the very first university spin-off partner
Yes.
from the University of the Philippines in the area of health biotechnology.
Recognized as one of the Asian top 100 scientists by the Asian Scientist magazine in 2020. Ladies and gentlemen, let us all welcome Dr. Raul V. Destura.
Good morning, everyone. Allow me to tell you our story, our light bulb moment, how one diagnostic kit paved the way for a sustainable momentum towards prosperity and wealth creation. Next slide, please. So it all starts with an idea when you develop a research proposal. But I kept on telling my mentees that an idea will just remain an idea unless you execute them. Next slide. So let me tell you about the journey of the idea, what happened to it, and where the idea is heading. Next slide. So it starts with needs assessment. From our own team, we went out there and asked ourselves, what is the unmet need in the country? And at that time, we realized that one of the biggest needs in healthcare is access to the most powerful diagnostic technology enjoyed already by developed countries. Next slide. So, next slide. So the cost-limiting nature of the molecular tools for diagnosing infectious diseases in the Philippines led to the creation of the Molecular Diagnostic Program at Biotech Manila way back in 2007. So we created all these pipelines through the support of the Department of Science and Technology and all of their councils, and such program has been adapted to the next phase of our technology development. Next slide. So it was adapted as a first flagship program for communicable diseases of the Philippine Genome Center and the NIMBB UP National Institutes of Health in 2009, which created, next slide, the next program, the PICC Dengue Aqua Kit. The journey of this technology was never easy from the very beginning all the way to the end. But because of that, it allowed us to be recognized internationally, and then we moved things forward. What happened to the idea? Next slide. So we wanted this technology to reach the end, wherein the target end user should be there. There were no company willing to take a chance. There were no expertise in diagnostic kit manufacturing in the country. There were limited knowledge in technology commercialization from bench to bedside to community. There were limitations in the number of scientists skilled in both the art of science and entrepreneurship. Next slide. So we were thinking spin-off, spin-out, start-up, but then we wanted the assistance of the university, so we decided to do the weirdest thing scientists will do, bite the bullet and do a spin-off company. Next slide. Through the Tech Transfer Act of 2009, it helped faculty members to translate their fundamental work to commercialization. Next slide. So it was approved at the Board of Regents of the University of the Philippines, the birth of the first university spin-off company in the University of the Philippines, Manila. Next slide. The Manila Health Tech Incorporated. Next slide, please. So the Labinamag project has been field evaluated and distributed, next slide, to the following regions. At Region 5, next slide, Region 4, and then all of this one listed down here, next slide. But we're also going international through the support of A-Star Singapore, which was a little bit derailed because of the COVID-19. We're reopening our doors again to bring this all the way to the other side in the Asian region, our neighbors. Next slide. So from one technology, we generated over 50 new ones, and currently there are 16 undergoing patent application. Next slide. So where is this heading now? Next slide. From light bulb in support of the government's effort to jumpstart our technology, we're going to the light hub. Next slide. Next slide. Next slide, please. So to be the first health biotechnology company in the country or in the Philippines was never an easy task. The last 5 years were filled with ups and downs, but we took every lessons we had to heart. We drew our strength and perseverance from each other and from our innermost desire to be able to serve our country and take pride in the ingenuity of the Filipino scientists. Well, the normal course of biotech growth in developed countries takes years to reach significant milestone. That did not discourage us to give it a try. So from the bottom of our hearts, I would like to thank the University of the Philippines and the holding hands of the Department of Science and Technology for the support in this endeavor. Next slide. So let's have the biggest dream. Let's start somewhere and let's persevere. Last slide. Thank you very much.
Thank Thank you so much, Dr. Desura. Maraming salamat,
Right.
sir.
Our next speaker is a pharmacist, microbiologist, and natural products chemist whose expertise and research interests cover microbial, marine invertebrate, and plant natural products for drug discovery.
She is a prolific researcher and was engaged in several drug discoveries, scientific research undertakings at the University of British Columbia in Vancouver, Canada, and Washington State University in the USA before returning to the Philippines as a Balik scientist in 2015.
And just recently, she was awarded the 2022 Australian Alumni Excellence in Innovation Award from the Australian Embassy in the Philippines. Ladies and gentlemen, please welcome Dr. Doraline S. Dalisay.
Next slide, please. Have you ever experienced any skin infections? Katulad ng pigsa, tagyawat, o sugat na naging sanhi ng infeksyon sa balat? If left untreated, these skin infections can cause sepsis and eventually lead to life-threatening health conditions. Next slide, please. This is because the skin pathogens that cause these infections, unfortunately, developed resistance against antibiotics. Therefore, antibiotics available in the market are no longer effective against them. Next slide, please. Through the academe-industry partnership and the funding support of DOST PCHRD, the University of San Agustin and Maridan Industries Incorporated in Iloilo joined forces to develop a skin antibiotic pharmaceutical product from a Philippine plant. Next slide, please. Our team investigated a very common plant known as Cadjanus cadjan, or commonly known as Cadjos in the Philippines. Cadjos is grown as food, especially for its seeds. In Iloilo, Cadjos seeds is an ingredient of a local delicacy, Cadjos baboy langka, because of its high content for proteins, phytochemicals, carbohydrates, fibers, and vitamins. Next slide, please. Based on our preliminary work, we have demonstrated that the Cadjos extract has antibacterial activity against skin pathogens, indicating the presence of natural antibiotics from Cadjos extract. Next slide, please. So, in order to isolate and identify these natural antibiotics, the first thing that we did was to partner with a local farm for the supply of raw material, followed by the extraction of the phytochemicals, and also antibacterial screening against paint pathogens, isolation of the antibiotics, and metabolomics using mass spectrometry to identify the identity of these antibiotics, and formulated a product for skin infection. Next slide, please. Our team identified 6 natural antibiotics from Cadjos that were responsible for the antibacterial activity. Next slide, please. These antibiotics are active ingredients of a formulated product with a trade name called Skivius. Skin invigoration from Cadjos. Skivius. Our team formulated 2 products, a toner spray and a serum gel. Next slide, please. Based on our work, we have demonstrated that these formulations are effective as antibacterial agents against skin pathogens. Formulation testings, such as biocompatibility, stability, and animal testings, are currently in progress for FDA product registration. The impact of our work is that we support local farmers. We also reinforced antimicrobial arsenal and provided new sources for antibacterial antibiotics such as functional food. And hopefully we will boost the local and national economy through the production of our product. So next time you have a skin infection, use Skevious, a natural antibiotic from Kadyos. Produkto ng mananaliksik sa Iloilo, galing sa yaman ng Pilipinas para sa Pilipino. For more inquiries about our product, send us an email at c2b2@usa.edu.ph and info@maridan.com.ph. Maraming salamat po.
Thank you, Dr. Daisay! Alright, next in line is a seasoned and published academician, researcher, and public servant. A sterling leader, she has won a number of awards at the regional, national, and international level, and is now currently serving as in her second term as the president of Mariano Marcos State University.
Let us all watch this video presentation from
Dr. Shirley C. Agrupis.
The rich plant resource of our province, Ilocos Norte, is home to various indigenous species serving as food and medicine to our fellow men. These food plants form part of our local food culture and indigenous medicine for common illnesses. Recognizing their great potential in the pharmaceutical industry, we initiated efforts for the establishment of the Tuklas Lunas Center, or what we call the TLDC, in Mariano Marcos State University with the full support of the Department of Science and Technology, Philippine Council for Health Research and Development. With the TLDC, I and my team of equally dedicated professionals aimed at searching potential drug resources, capitalizing on the indigenous plant species in Ilocos Norte. Since its establishment, our efforts focus on identifying underutilized, neglected IPs in support to the pharmaceutical industry while presenting alternative source of income for communities who will produce the raw materials. The ongoing project, formulation of herbal dosage forms from standardized non-toxic bioactive extracts, pursues the herbal track of product development, most notably on IP's modulatory role in inflammation. The project aims to develop standardized, safe, and effective anti-inflammatory herbal products in response to the high incidence of inflammatory-related diseases that contribute to a range of disorders such as allergies, heart-related illnesses, metabolic syndrome, cancer, and autoimmune diseases. The delivery of the project was a very challenging task. Together with the researchers, I dealt with government protocols to successfully indulge the cohesive IP community in our collection sites, especially in Adams, Ilocos Norte. Our path was clearly a road not taken. However, the challenges did not hinder us from pursuing our goal. This did not outweigh our drive to produce alternatives to cut the rising medicine costs and the known adverse effects of synthetic medicine in the overall health of our Ilocanos and the Filipinos in general. Emboldening the Ilocano diligence and compassion, our TLDC team pursued to give the public a cost-effective medicine for general health and wellness. Through the conduct of screening assays and other tests, we have proven the anti-inflammatory activity of 37 IP-derived extracts. From this number, 23 extracts have anti-inflammatory activities determined via enzyme-based assay, with 7 extracts showing dual COX and LOX inhibitory activity. These extracts were found safe for the heart, liver, and kidney cell lines, hence showing bigger potential for illnesses common to the public. Based on these results of the study, we prioritize 5 IP extracts for formulation studies to establish quality, safety, and effectiveness standards as pharmaceutical dosage form, particularly their oral and topical dosage forms. At the moment, we have already produced formulations of herbal ointment and capsules and are undergoing stability tests. The big goal we have in mind is better health for all. And this will be achieved with the continuous support of the DOST-PCHRD, our industry partners such as the Pascual Laboratories Incorporated, the University of the Philippines, Diliman, and in mutual agreement with Indigenous Peoples Community in Adams, Ilocos Norte. With the MMSU TLDC, we commit our relentless effort to produce affordable medicines. And in this hope, we shall address the increasing demand for cure of inflammatory-related diseases. This is MMSU's TLDC, your university with a heart.
Thank
you, Dr. Agrupis.
All right, so next, let us listen to a faculty member and the academic research coordinator of the Pharmacy Department of San Pedro College, or SPC.
He is the head of the Quality Assurance and Linkages of the SPC Animal Laboratory and Research Hub, and currently pursuing his PhD in pharmacy at the Centro Escolar University. Take it away, Mr. Joseph Marie B. Kerekensha.
Mic test. What if a sought-after delicacy from Mindanao could also be a medicinal plant? Possibly, this scientific account could prove it. And I'm talking about marang fruit. Marang fruit or marang plant is a native plant species in the Philippines, which shows some potentials as a popular product for desserts and delicacies. Its characteristics or properties are just similar with jackfruit and breadfruit, but it is quite smaller and softer than jackfruit and quite larger than a breadfruit. Marang fruit, or the fruit of marang, is esteemed because of its palatable taste and pleasant and sweet odor, especially when it is ripe. It is grown in the marginal areas of some provinces in Mindanao, specifically in North Cotabato, Davao provinces, and Agusan provinces. And it is seldomly or limitedly found in areas of Luzon and in Visayas. There is no identified or acknowledged marang plantation since it is a volunteer crop. Yet, there are large areas where marang trees or marang plant species are abundantly growing and propagated. This scientific project was aimed to prove the safety and efficacy of marang as a medicinal plant through laboratory-based and animal-based models and techniques grounded on these experimentations. The sample of the fruit of marang contains active compounds, specifically polyphenols, and it possesses biological activity. High doses or high amounts of marang fruit sample is safe and remedially effective and active as well. One of the main social importance or scientific account would be a source of information about the therapeutic utilization of marang and for other future health research studies concerning tropical fruits in the Philippines. The technical knowledge established from this project could also serve as a mode of awareness for those sectors, people who propagate and locally and internationally export this native fruit about its health-giving properties. The fruit of marang is not just a local dessert product. Nevertheless, it is an innocuous and efficacious medicinal plant. Thank you so much for listening in my short presentation. Good morning, everyone.
Thank you, Mr. Kerekensha. All right. Our next speaker is the director of the UPLB Museum of Natural History. She pioneered researches on exploration of the Philippine caves for novel and potential microorganisms with bioactive compounds. Everyone, let's give it up for Dr. Marian P. De Leon.
Are places which are considered as rare environments. But there is more to be discovered underneath. There is wealth of beneficial, thriving microorganisms, highly regarded as important to animals, plants, and to us humans. In 2021, the World Health Organization stated that the emergence and spread of drug-resistant pathogens continue to threaten our ability to treat common infections. Besides, existing antibiotics become ineffective, increasingly ineffective, and drug resistance spreads globally. Thus, it's a more challenge to treat these infections. Hence, this urged us to conduct this study. Producing antimicrobials is not new to the Philippines. In fact, Dr. Abelardo Aguilar, a Filipino doctor in Iloilo City, discovered in 1949 a strain of bacteria from the soil in his backyard that led to the development of erythromycin under the brand name Ilusone. For this study, we have explored Caballo-Risa Cave in Mabini, Pangasinan, where we collected bat guano samples for the isolation of new microorganisms as new sources of antimicrobials. Next slide, please. Bat guano is a mixture of excrements and remains of bats collected in caves. This serves as main source of energy inside the cave and supports the growth of fragile and unique organisms, including microorganisms. Guano satisfies, even exceeds, the requirement for a good organic fertilizer. It has a total NPK higher than agricultural fertilizer, including vermicasts. Next slide, please. Through high-throughput sequencing, metagenomics of the bat guano showed streptomyces, which has a characteristic to produce antibiotics. Next slide, please. Functional profilings of the genes present in bat guano showed diverse functions of the microorganisms, from metabolism of bigger molecules up to biosynthesis of other secondary metabolites, including enzymes and antibiotics. Next slide, please. Conventional isolation and purification, as well as combination of phenotypic and genotypic characterization, showed new species of streptomyces with two strains, namely AC142W and AC142T, which were found to be very effective against representative gram-positive and gram-negative bacteria, which are causative agent of bacterial infection. Moreover, predicted secondary metabolites and associated gene clusters in this species are found to be new and has not been deposited in accredited or reputable databases. An example of which is the lasopeptides that possess remarkable thermal and proteolytic activity with a number or various biological activities. Next slide, please. More importantly, they have promising potential therapeutic effects on gastrointestinal diseases, tuberculosis, Alzheimer's disease, cardiovascular disease, fungal infection, and even cancer. Next slide, please. Interestingly, through the gene cluster analysis, it is now easier to target the bioactive compounds from this new species of streptomyces. Next slide, please. Next slide, please. So what's next on this new species of streptomyces? They are now being tested against multi-drug and extremely drug-resistant Mycobacterium tuberculosis, a causative agent of tuberculosis, which until now has not been fully eradicated in the country and has evolved into different levels of resistance against currently available antibiotics. The Philippines is endowed with rich natural resources, including rare environments like caves. Thriving underneath are not only unique fauna, but also diverse, potent, and novel microorganisms, new sources of antimicrobials to face emerging and re-emerging infectious diseases. Thank you very much. That's all.
Thank you, Dr.
Dr.
De
De
Leon.
Leon. Grabe, partner. So many things to learn and we're just warming up.
Yes, at syempre po, once again, in-invite natin lahat na please share po yung ating live streaming via Facebook at DOST-NRDC.
Yes, we are live via Zoom, Facebook, and YouTube, partner. All right? Our next speaker is an epidemiologist and hematologic oncologist. She advocates for screening and early detection of cancer and is the founder and CEO of Cancer Care Registry and Research Philippines Foundations, Inc. Please welcome Dr. Beatriz J. Tiangco.
About 7 to 10 million Filipinos are positive for hepatitis B virus and are at risk for developing cirrhosis and eventually liver cancer. If caught early on, liver cancer can still be cured through surgery, a one-time procedure which can cost 150,000 pesos at tertiary government hospitals. If caught at a later stage, the cancer becomes incurable, and the cost of extending a life of one in advanced stage is 150,000 pesos per month for the rest of the patient's life. Unfortunately, worldwide and local data show that the incidence and mortality rates of liver cancer run neck and neck, which manifests the incurability of the disease because it is usually diagnosed in the advanced stage. Primary prevention through vaccination is one way to eventually lessen the death rate from liver cancer. Another way is to do secondary prevention or screening, which involves a combination of liver ultrasound and blood biomarkers. These have been tried and tested in many countries with the hope of being able to predict who are more or less likely to develop liver cancer and screen in those who may already have the disease. Good morning. My name is Dr. Beatriz Tiangco, and I am the program leader of the CANDLE study. CANDLE stands for Early Cancer Detection in the Liver of Filipinos with Chronic Hepatitis B using AI-driven integration of clinical and genomic biomarkers. It has 3 projects under it, 2 of which are currently ongoing. Project 1 is a 5-year study that we aim to finish early this 4th year that deals with the establishment of a clinical and genomic profile of Filipinos for early detection of liver cancer. Project 2, a 3-year study on its 2nd year, is about artificial intelligence-driven integration of genomic with clinical biomarkers for early diagnosis of liver cancer. Project 3 focuses on profiling the glycoproteomes of liver cancer patients with and without chronic hepatitis B. The first project aims to validate the accuracy of a globally available scoring system for liver cancer called GALAD scoring among at-risk Filipinos. This project also wants to find at least 10 genetic variants unique to Filipinos contributing to liver cancer diagnosis and prognosis. Data and samples gathered in Project 1 will also be used for Project 2 and 3. Our artificial intelligence project will utilize serum biomarkers, clinical and genomic data, and ultrasound images in developing a scalable AI-driven application prototype that will hopefully facilitate an even earlier and more accurate diagnosis of liver cancer. Our glycoproteomic project will make use of the stored serum samples from 100 participants of the CANDLE study in order for us to identify a new class of liver cancer biomarkers that may someday allow the early detection of liver cancer not from a liver cancer tissue obtained by a risky biopsy procedure, but from a single drop of blood obtained by a painless pinprick of the finger. Currently, CANDLE study recruitment is at 91% completion despite the challenges brought about by the COVID-19 pandemic. We are the first study to be granted approval of the use of tele-informed consent and teleconsultation by different ethics committees, which significantly helped increase our numbers. We are at 86% completion on genomic profiling with the help of the Philippine Genome Center. Validation of GALAD scoring among Filipinos is at 86% and training of our AI model is at 60%. All deliverables are on track despite the pandemic. The clinical and genomic group have started writing papers and we hope to be able to publish these papers in peer-reviewed journals soon. With the continued support, guidance, and very generous funding from DOST through PCHRD, we are optimistic that our study objectives will be met and we will succeed in contributing to better healthcare for the Filipino liver cancer patient. Moving forward, we envision our study to be replicated in all types of cancer. To achieve this, we need your help. First, we will need funding. As researchers, we want studies like ours to be expanded, validated, and then replicated. And we can only do this if we have funding available to pay for the technology and people required to undertake this ambitious program. Second, we want our researchers to travel the path from bench to bedside and be useful to the general public and those at risk for cancer. Help us spread the word that we have locally designed and available diagnostic tools for early cancer detection. And last but not the least, a very important one, we need to help each other and every sector, government and private alike, as we adopt the all-of-society approach to better healthcare for all Filipinos, which is the first and necessary step toward a better and healthier Filipino nation. On behalf of this fantastic CANDLE study team, we wish you good day and a successful conference. Maraming salamat po.
Thank you, Dr. Bianco.
Our next speaker is a faculty and research scientist at the Ateneo de Manila University. A physician by training, he finished his postgraduate course in community health for developing countries at the University of Heidelberg, Germany.
He started his career as a community physician working with community-based health programs and co-founded the Community Medicine Development Foundations, Inc. or ComMed. He also pioneered various social innovations in public and community health. Let us all welcome Dr. Dennis Batanan.
Good morning, everyone. I will be presenting the IHATID LGU project of the Ateneo de Manila University on behalf of the IHATID team. Anong IHATID ng IHATID project? Let me tell you our story. The IHATID project started in around 2012 with support from PCHRD UST as a techno-governance project under the Community Empowerment for Science and Technology of the Department of Science and Technology as a innovation project for social action and implementation research. It was an e-health solution that was intended to support the evolving local health system of the country. It actually is followed actually the WHO ITU recommendations as well as the eventually the universal healthcare guidelines from the Department of Health for responsive health systems. The e-health LGU project was also framed under the National Unified Health Research Agenda of the Department of Science and Technology, primarily through PCHRD, and to support the health information system requirements of local government units, which eventually became the HIS provision of the Universal Healthcare Law. In 2013, we developed the prototype for e-health LGU mobile application with an EMR intended for local government units. It's actually an EMR that was eventually enhanced to be able to have a communication function between the users, a dashboard showing real-time visualization of the data, and generation of reports intended for field health and the Department of Health. These innovations actually were overtaken by events, particularly the Universal Healthcare Law, and of course the COVID-19 that we experienced in 2020 and 2021. So these current features are actually still in transition as we try to comply with the UHC provisions. In the meantime, it has evolved into a derived project or derived work called the Universal Healthcare Law. It's a co-designing and co-development process for local health information systems of local government units, and a capacity building component to be able to support the development or creation of community of practitioners for local health information exchange in the Philippines. This MILHIS, or Smarter Integrated Local Health Information System, actually also was developed within the context of the Smarter Cities program of the Department of Science and Technology and the Universal Healthcare Law, particularly the province-wide and city-wide health systems direction of the Universal Healthcare Law implementation. Currently, the prototypes of this particular MILHIS Local Health Information Exchange are in Cagayan de Oro City for the city-wide health system and Pangasinan Province for the province-wide health system. So these photos actually show the launching of this event also here in PICC in 2019, and also last year with the province of Pangasinan for the UHCLens project. We also pursued, again with the guidance of the OST, the IPR registrations. These are the trademark, utility model, and applications, including a patent application, which we hope we will be able to secure next year. Among the milestones last year includes the People's Choice Award from the OST TAPI, Certificate of Recognition also as part of the Gawad Kisig, and a bronze prize for the outstanding pending patent under the Philippine National Inventors Week celebration. We also have received some recognition also from the Pangasinan province and of course Cagayan de Oro City, who actually also won Galing Pook Award, including the MILHIS that we contributed to their. It was shortlisted in a Frontier Technology Award and eventually was accepted or approved for implementation later this year. So anong may hatid ng ihatid? I would say it's following the DOST mantra of people-centric technologies for Filipinos by Filipinos. Magandang umaga po, mabuhay ang NRDC.
Thank you po. Coming up is a professor at the Institute of Biology, University of the Philippines, Diliman. His current research focuses on cell cycle control, cancer and cellular aging. He is also interested in exploring treatment and interventions that will help eliminate or lessen the negative effects of environmental chemicals on human health.
He came back to the Philippines as a balik scientist in 2016, and in 2019, he was recognized as one of the outstanding young scientists by the National Academy of Science and Technology, or NAST. Ladies and gentlemen, Dr. Michael Velarde.
Breast cancer is a top type of cancer across the world, but it's not necessarily the leading cause of cancer-related deaths in these countries. In the Philippines, however, breast cancer remains the top killer of women when it comes to cancer. In fact, in Southeast Asia, the Philippines has the highest death due to breast cancer, just falling a little bit short of Brunei. Well, why is this the case? Could be because of the type of treatment that we have. Maybe it's poor healthcare system, but maybe it's more complicated than this. Maybe it's embedded in our DNA. Maybe it's the type of the food that we eat. Maybe what we're exposed to. So it's very important to understand the Filipino lifestyle and relate it to breast cancer in order for us to understand the mortality rate in the Philippines. Well, it's easier said than done. Have you been in our healthcare system lately? Wherein our medical information is still collected manually. You go to your doctor, have your checkup, you fill out this medical information on a piece of paper, and then your doctor says that, well, maybe you need to have your test done. So you go to a different department, fill up a very similar medical information there, and then get your test results, bring it back to your doctor, and then your doctor would see that, oh, you need to do additional tests. Then you look for another department, and then have your test results there done, but then you have to fill up all of this medical information exactly the same as how you originally filled out those medical information. And then if you have multiple tests done, you will do all of this all over again. Well, how do you wish that there is just this one system where you can just put all of your medical information there, and then when you need to retrieve all of this information, you just give it to your doctor. Similar to how you put your cash in a bank. But instead of entrusting your money to the bank, you entrust your medical information. And better yet, if you want to donate your medical information and also your biological samples to science so that you can help scientists find treatments for breast cancer, you can easily do so. Maybe simple as sending your information to the scientist, kind of like how you send cash, like GCash, to another scientist. But instead of cash, you send out your information. This is the whole idea behind the project, the Biobank project, initially funded by PICC and now sustained by DUSD projects. In this particular project, we have already stored multiple medical information, also stored their associated biological specimen, like cells. We can now grow cancer cells, and also blood samples that we can use to analyze breast cancer and related to exposures of patients. In fact, in this particular project, we were able to identify multiple chemicals that are found in plastics that are also found in Filipino women, circulating in the body. And some of these plastic chemicals can go as high as almost 100-fold higher compared to women in the US. Imagine plastic circulating in the body. And some of these chemicals are also elevated in women with breast cancer. So with all of this information, with this biobank, we can now explore the Filipino lifestyle and maybe the DNA found in Filipinos and related to breast cancer. The wealth of a country is not only measured by the amount of money you can put in a bank, but it can also be measured of how much information you can store in that, and then be able to retrieve those information to help treat diseases and help improve the health of the population. Thank you.
Thank you, Dr. Velarde. Our next speaker is a physician scientist and currently the director of the National Telehealth Center, National Institutes of Health and University of the Philippines, Manila.
He is also a clinical assistant professor of the UP College of Medicine's Medical Informatics Unit and chair of the Health Informatics for Development Working Group of the International Medical Informatics Association. Let us all watch the video presentation from Dr. Raymond Francis R. Sarmiento.
Good morning, everyone. I'm Dr. Raymond Sarmiento. I serve as Principal Investigator of the study entitled Operations Research and Modeling on the Implementation of mHealth Services in the Philippines. This was supported through an AHEAD HSPR project, primarily spearheaded